Welcome to familydoctor.expert. Today we're going to be talking about gastroenteritis or food poisoning, a very, very common problem that we see in general practice. Probably a week doesn't go by without seeing quite a few people with this. So people can have all sorts of problems. They might have nausea, they might have diarrhea, they might have vomiting, they might have body aches, fevers. Usually I know pretty quickly when someone comes in from the waiting room. They're sometimes very nauseous. They might have a bucket that they've been vomiting in, unfortunately, or they're looking very ginger and really not very happy. So what causes gastroenteritis? I mean, a lot of the gastroenteritis we can get from foods or from not washing our hands, and I'll talk about some of the things we can do to prevent it. But gastroenteritis can be caused by viruses, can be caused by bacteria, can be caused by parasites, can be caused by the toxins produced by bacteria, which can sometimes just be sitting in the food or in milk sometimes. And then there's some non-infectious causes of gastroenteritis, which we're not going to talk about as much. So I'll talk to you about some of the common sorts of gastroenteritis that I see in the clinic. And there's quite a few technical names. It sounds a little bit more like an episode of some science fiction movie, but bear with me. So the common one we see in Australia anyway, it's often viral gastroenteritis. And usually people are a bit nauseous, maybe a bit of vomiting, a bit of diarrhea. 24, 36, sometimes 72 hours. They tend to get better if they just drink enough fluids and stay away from work or school for a couple of days, and they're fine. But we do see some bacterial infections, particularly E. coli, can occur in anyone. Quite a lot of people who are travelling get what's called traveller's diarrhea from E. coli. Another one that we see in some people is called Giardia, which is a parasite. And very often people have had quite a lot of cramping and gas, even for a few weeks or even a couple of months. Sometimes they've been travelling. Very often they've had a bit to do with kids, possibly a creche or nappies or that sort of contact. And we like to pick that one up because we can treat that one really well with antibiotics. There are other sorts that we see in the clinic. Salmonella, we see a bit of that, particularly from raw or undercooked eggs or chicken. Can be contaminated food. People can get quite sick quite quickly. People who've had the infection actually excrete the salmonella in their faeces. So again, we emphasise the importance of hand washing and good hygiene to prevent that. Shigella is a little bit like salmonella. Can cause a really severe dysentery, particularly in the developing world. It's one of the most common infections causing gastroenteritis. There's another one called Campylobacter, particularly from uncooked meat, especially chicken again, unpasteurised milk. You get it from animal feces, so any lack of hygiene, sand pits where animals have been leaving feces, that kids are at a risk of catching it there. And then there's another sort called Cryptosporidium, which is a parasite which can cause a watery diarrhea. So you can see there's many different sorts. As I mentioned, it does sound like a bit of a science fiction movie, but most people that we see in Australia anyway come in with a viral gastroenteritis, but your doctor will also be checking and thinking about these other ones as well. So what to expect when you come to your doctor? The biggest thing they're worried about is your level of dehydration. So they'll be trying to work out if you're having enough fluid and if you're still urinating okay. They'll be interested if you've been travelling, if you've had any contact with animals, is anyone else sick at home? They'll do an examination, they'll have a look at you. Do your eyes look sunken? They'll check your pulse rate, they'll examine your abdomen and see if you're sore, if you've got any pain anywhere. They'll also be thinking about other possible causes, because gastroenteritis can sometimes be the wrong diagnosis when someone's got something like a urinary tract infection or even something serious like a meningitis or something else. So your doctor will be keeping an open mind when they have a look at you. They might want to do some blood tests. It's very likely that they'll want to do what we call a stool microenculture. So they actually get you to do a stool sample, and they send this off to the laboratory and they have a look under the microscope and see what sort of infection you actually have. And that's really important because viral gastroenteritis we can't do much about in terms of antibiotics and things, but if we do detect a particular sort, some of those ones that I mentioned earlier on, then that's good to know because we can treat those. I want to talk a little bit about kids because gastro is common in kids and kids can get pretty sick pretty quickly. It's usually a virus. The kids may have some other viral symptoms as well. They might have a runny nose or a sore throat. Usually starts with vomiting and it usually lasts 3 or 4 days. The sorts of things that would push me more towards maybe a bacterial gastroenteritis if they've got a high fever or they've got a lot of abdominal pain or if there's any blood or mucus in the diarrhea. So these would be important things to tell your doctor. Now, as with a lot of these videos, there's a few red flags that jump out to me that you really need to get checked quickly with your child. If your child's less than 6 months, they really need to see a doctor. If there are signs of dehydration, and I've mentioned some of those, but a dry mouth, dry tongue, sunken eyes, not passing urine, cold hands, cold feet, sleepy or drowsy, or if the child just won't drink fluids. And from my time when I stinted at a children's hospital, I remember the sorts of children being brought in. You didn't have to be a rocket science doctor to work out they were pretty sick. If the kid's really looking listless and lacking in energy, you really need to get to the hospital. The reason is that the child may not be able to get enough fluid in just via oral fluids. They might need what we call a nasogastric tube. It's a little tube they put up the nose to put some fluid directly in the stomach. In severe cases, they might even need to put an intravenous drip in to make sure that the child gets enough fluid. So those red flags are important, particularly for the really young ones under 6 months, but for any kids that are showing those signs. So, what can we do to avoid spread of gastroenteritis generally? I think it's important that kids and adults don't go back to school and work too early, don't share towels, avoid preparing food. If you do have to prepare food, wash your hands really well before, avoid public swimming pools, don't use the same implements with raw and cooked foods, really important. Keep the kitchen very clean, the surfaces clean, and there's a nice rule of thumb that in terms of cooking, cold food should be below 5 degrees and hot food should be above 60 degrees. And the reason for that is those extremes of temperature, the bacteria can't multiply. Also, we mentioned that there's a few types of gastro you can get for eggs, so don't eat cracked eggs or eggs that don't look clean. Keep bathrooms and toilets clean, obviously. Wash your hands thoroughly, and pretty much any time you've been to the toilet, changing nappies, smoking, sneezing, touching your face for any reason, touching animals, working in the garden, wash your hands. And washing your hands, it's tempting sometimes to just put a little bit of water and give a bit of scrub, but we really need warm water, a bit of soap. For public places, probably one of these sort of squirting soaps is better than the actual cakes of soap. Make sure you do under the nails, do all the fingers. If you're wearing rings, take them off first. Make sure your hands are dried properly at the end. So it all sounds a bit obsessive, but I've been in a few events where we've seen really nasty gastro outbreaks, and really some of these measures, particularly with washing hands, for all the fancy medicines we had, washing hands is probably the best thing we can do. Now, fortunately, we've got some good vaccines. The last few years we've had the rotavirus vaccine, which is great for kids because rotavirus is really one of the common causes of gastroenteritis. For people travelling overseas, the oral cholera vaccine is also very good and worth having. Just a few tips for travellers. Only drink bottled water. That includes brushing your teeth. Avoid peeled fruits and vegetables, so you want to peel them yourself. Avoid uncooked foods. Avoid the ice in the drinks. That's easy to ask for no ice. Now, I just want to talk a little bit about fluid replacement, particularly in kids, because as I mentioned, they're much smaller and they're much more likely to get dehydrated. So, breastfeeding, keep doing it. If you're breastfeeding the child, or suitable fluids. Now the pharmacy sells some special oral rehydration fluids. I think it's a great idea if you're travelling to take some of those with you. If you don't have those with you and you can't access them, a couple of tips about other sorts of fluids. I don't recommend the sports drinks. They're very concentrated and they're really not appropriate for the kids. You could get a little bit of cordial, concentrated cordial, but you'd need to dilute it right down, like about 1 in 20, so just a tiny bit of the cordial and mostly water. Or fruit juices or soft drinks if you're going to use one of those, because the sugar does actually help the child absorb the fluids. Again, very, very important that that gets diluted down, probably 1 in 5 or 1 in 6, so just a little bit of the soft drink, and you really need to dilute it down. There's some really specific advice on how many meals you should give to which children at which age, which I'm not going to cover today, and is something that you should consult your doctor about. A couple of other principles with kids: frequent small sips, so just keep the fluid going in regularly. The recommendation now is if they do feel up to eating, they can have a bit of food. I recommend non-fatty foods. Those sort of very simple foods I think are good for kids when they feel like eating again. Keeping in mind those red flags, if the kid looks dehydrated, don't hesitate to get a doctor to have a look at the child and see if they need sort of more intensive rehydration. Now, in terms of medications, generally we don't use a lot of medications for people with gastro. Some people coming in feeling absolutely lousy will give an injection of either some Stemetil or some Maxilon to try and settle down that horrible feeling of nausea. The anti-motility agents, things like loperamide, I tend not to recommend, in the sense of we want, if people are having diarrhea, often it's washing out the infection. Particularly not recommended for children, not if they've got bloody diarrhea, not if the patient's got diarrhea with fever. But some people want to use the loperamide just for a short term, if they're just in a situation where it's really awkward for them to be running to the toilet the whole time, and in that case, that's fine. Now, antibiotics, as I said, most of the cases of gastroenteritis are viral, but if we do pick up particular sorts of bacteria, the macrolide antibiotics are very good. For Giardia, there's a couple of excellent antibiotics. Metronidazole or tinidazole are very good. So there's a lot of information there about gastro. It's very common. As I said, at least in Australia, most of the cases we see are viral and self-limiting, but the big thing to watch out for is dehydration in anyone, but especially in kids, and you should really get checked with your doctor. So I hope it's given you a general overview. As mentioned with all these videos, it doesn't replace going to the doctor, and I wish you well from familydoctor.expert.